Hi, this is Piyush Bhargava, and I have a few interesting cases to share with you. This video is the second part of Spect CT applications in nuclear medicine. On this slide, we are looking at images on a patient with history of prostate cancer who presented with rising PSA, and their CT scan of the abdomen and pelvis with IV contrast was negative, along with a negative whole body bone scan. In this situation, we decided to do a prostatocin study, and we're looking at anterior and posterior whole body images. There is ill-defined focus of increased uptake in the mid-abdomen, and this was localized using a Spect CT seen here, transaxial CT image, and a transaxial fused Spect CT image. The increased uptake corresponds to small mesenteric lymph nodes, and this is consistent with metastatic prostate cancer. The next patient presented with history of right knee prosthesis and a painful right knee. We performed an indium 111 WBC scan, and we have anterior and posterior whole body images showing large ill-defined focus of abnormal accumulation of indium labeled white blood cells extending from the right thigh into the right knee. And the Spect CT showed that they have a prosthesis, a femoral prosthesis that continues as a knee prosthesis. There is abnormal fluid density in the anterolateral aspect of the prosthesis, which is where there is abnormal accumulation of white blood cells. There is also an air fluid level here, and these findings are consistent with abscess formation in this region. So prosthesis related infection and abscess formation in the right knee. The next case here is on a patient with history of prior resection of a paraganglioma. They presented with recurrence of symptoms, abnormal labs, and imaging was performed to look for recurrent disease. We did an indium I-123 labeled MIBG scan, and we're looking at anterior and posterior whole body images. There is a focus of abnormal uptake in the abdomen, in the right paramedian abdomen seen right here, and this was localized using Spect CT to this abnormal soft tissue density at the level of the renal hilum. So Spect CT helped us localize the activity to an abnormal focus, which was later resected. So Spect CT in all of these three cases provided valuable information in patient management. Check out this article that we published a few years ago. The text is available for free online, a pictorial review of Spect CT imaging applications in clinical nuclear medicine. Thanks for watching.